Hi, I'm Lori Kane from Dr. Dean Kane's office, our Center for Cosmetic Surgery and Medi-Spa. Today we're going to talk about microneedling with PRP. We're introducing that into our practice. It's a new form of trying to induce collagen into the skin in a different format. The microneedling with the skin pen will provide the little channeling through tiny little needle puncture spots in the face. And then PRP is from my own blood. So we'll be taking the blood out from me. They'll be spinning it down, which we'll be showing you this process, where we separate the red blood cells from the plasma-enriched portion. This plasma, the protein in the plasma is growth factors and healing factors. So when it's applied to the face over this channeling, it really, the combination is very soothing, healing, and the whole point is to induce collagen production into the face. It's excellent for fine lines, skin texture, acne scarring, firming and tightening and smoothing. So we're going to take you through the process. I'm going to have that done to myself. The goal is to actually do my face, neck, and chest. So I'm going to do all three today, and you'll see the demonstration live. Here we go.
Lori's going to do the PRP treatment with the microneedling, and in order to do that, we draw the blood, we spin the blood, and the blood separates, and we have this wonderful rich serum that we then put on her face after the microneedling has been done. So I'm going to get ready to draw her blood now. And we're filling up the tube of blood.
So we're taking the blood that we drew and we're putting it into this is called a centrifuge. It spins the blood, and what happens is this gel down here will separate plasma from red blood cells, and you have a platelet-rich plasma that is excellent to put back onto.
Here, we'll fix you up.
Yeah.
Okay. Lori's own blood, there's less chance of any sort of allergic response.
Now the other option is if people are really anti-using their own blood, you can use a serum like hyaluronic acid instead of the PRP. So there are options with PRP versus just using a serum. So we will offer that.
This is the skin pen that we use, and it's actually called Skin Pen. It is the only FDA regulated microneedling pen in the United States. It is activated through an easy touch system. You can control everything of depth by turning the tip. So you can go as shallow as you want to, which is 0.25 millimeters, or you can go all the way up to 2.5. So it's a very nice, it has all different levels of penetration that it can do.
And each second you are creating 1,400 channels into the skin.
Some people try to go online and buy home microneedling pens. A couple of problems with that is that the home pen can only go up to 0.25, and as we just said, this could go from 0.25 all the way up to 2.25, and we use different levels of depth depending upon what part of the face you're doing, or neck, or body part. The other important aspect is that these needles that are being used are very precise needles. The home ones tend to not have such precision needles inside, so they could actually cause more skin damage than actually having a more professional pen. So for those people thinking I could do this at home, you could possibly cause more skin damage to your face.
Okay. So after the blood has been transfused, this is what it looks like when it comes out. It has been separated. This is a medium. These are all the red, these are all the platelets, and this is all rich, juicy, golden plasma that will go back into Lori's skin.
Not so bad. Right now it's just light, like
Pinpricks.
yeah, not bad. I'm at a 2.
So you can see the pinpoint bleeding that's starting to happen. This is exactly what we want to see. We want there to be some pinpoint bleeding, but not over bleeding. So,
You don't want to get more blood?
I don't think it's necessary,
So-
says in there.
The forehead is supposed to be the worst because it's
Yeah,
bonier
the
and
forehead
thinner
is the
skin,
worst.
and really, that wasn't bad at all. Really, for me, it was 2 to 3. And I've had pretty strong TCA peels in the past. This is mild compared to a TCA peel. But I thought this is easier.
So now we're applying the platelet-rich plasma where we microneedled.
And it's very soothing and calming. I wasn't expecting how that works.
Do you think this is more effective than a chemical peel or different?
I think it's totally for a different purpose. So to me, this is getting at more texture problems, fine lines, and smoothing. Where a chemical peel, for me, I use chemical peels for real tightening, overall super tightening. But I don't know that it gets the texture. So like anybody with a lot of fine lines or scars, acne scarring, scars, like for me, my chest is really textury, and I can't tolerate a chemical peel on my chest. It's just too sensitive for that. So I think this is perfect for texture, fine lines, smoothing, firming.
I'm going to go up even another little bit for the rest of this part of the face. So each area we do 2 passes. It's actually called a crosshatch, where you go up and down and then side to side. Then go back over.
What areas of the body can you do the microneedling on?
You do everything.
Okay.
Probably the most traditional area is number 1 is the face. That's where most people have it done. Then you can do your neck, your décolleté, and your hands. Those are probably the top 4 areas that people have done. But you can literally do any area. The recommended is to do 3 sessions 1 month apart.
So what should Laura expect tonight?
Her face should be pretty calm. I mean, you can wash your face with a gentle cleanser after 4 hours. And then after that point, you can put on kind of more of a soothing type ointment.
Initially, it feels like a sunburn. Your skin will look its best in 10 to 14 days after the microneedling. You can use your products 3 days afterwards. We recommend absolutely no gym or any sweating for the first 24 hours and no makeup for the first 24 hours. But after moving on to Lori's neck, and we are wiping off the numbing cream. This is 1.25. Yes. How are you doing?
Not bad.
Okay.
I don't think it's any worse than laser hair removal. I mean, I think they all fall in the same category.
Okay, and then we're just going to gently treat the other areas. This is very soothing as we're working through the rest of her face.
Yeah, it really does feel good to have that put on. So my goal was to get a really good smoothing quality for both my neck and my chest, since I do a lot of chemical peels for my face, but I have a hard time tolerating strong chemical peels on my neck and chest. You will also get lightening. So that was the other plan, is that I want to get lightening and my texture improved. I think it looks worse than it is. It really is not bad. And I've had a lot of different things done to me, and I don't find this terrible. Yeah, so my face feels totally, except for being tight, it doesn't burn or sore or anything. And it's only been a half an hour, I think. This is so not hard to get through. So I'm under no medication, no nothing. I'm totally 100% fine. Since we're at it, I decided I've been wanting my hands done for a while. I've had bad sunburns on my hand, fine lines, so we're doing my hands now.
Let me get back over here.
You can really see on your chest now.
Yeah, so that's the thing, is it just peeks up as you're. Hi, I'm Mary Lou from Dr. Dean Kane's office. The three of us have done a series of microneedling today in different areas. I had Susan do my décolleté and my neck, a little bit of my face up here. I did Susan's face, her neck down almost to her décolleté, right to her collarbone area. And then we did Lori's microneedling, and we did her full face, full neck, and décolleté and hands. So as you can see, mine is not nearly as red as Susan or Lori because it's been about 5 hours since I had my microneedling done. It's very comfortable. There's nothing, you feel a little bit of flaking, but there's nothing irritated or stinging or anything for me. Susan is about 3.5 hours out.
Yeah.
That she had her full face and her neck done. You could tell she's still red. Probably going to calm down here over the next, couple of hours. But, she definitely looks like she's set on some. And then Lori just finished. And so she's bright pink. And it'll take her probably the next 3-4 hours to settle down.
And my face might look pink, but it's already stopped stinging. It's just tight now. So my face is already, and it's only been in a half hour, 45 minutes. So my face feels just tight, but nothing is burning or stinging. And I still have a little bit of stinging left on my neck and chest and my hands. But it's getting better with each minute.
So Lori could easily go out right now. She could go meet friends for dinner. She could go to the grocery store. She could go shopping. One thing we do want to caution you about is that we don't want you to put a visor on or a baseball cap. They harbor bacteria. We wear them on dirty hair. We wear them before the gym and after the gym. And if you're going to get an infection, you're probably going to get an infection from the dirty hat or the visor. Otherwise, there is hardly no infection or risk involved at all with going out with these open channels in the face.
And just in terms of going back to work, I could go to my computer, start working right now. You could see that Mary Lou and Susan, no problem going to work tomorrow. So really there's very little downtime to this whole process. Give ourselves 3 to 4 days, and the healing process is pretty much completed. And so it's a really, I would say almost next to no downtime.